Yeah, but I always say, for me, I say I'm blessed because I live to tell my story, right? I didn't die alone with my child. My child made it, right? So I always say I'm a blessed person that had this experience because not a lot of people, either they don't live or their children don't live to tell the story. So I'm Dr. Shawana Moore. I'm a women's health nurse practitioner by training. I'm also an educator, a researcher, but most importantly, I'm a mother to a now 8-year-old. I identify as a Black woman. I'm also a wife. And my birthing story really centers around listening to patients and really understanding what a patient may be experiencing and being heard and being valued and seen as a patient, right? For me, I haven't had another child because of my birthing experience 8 years ago, but it has had long lasting impacts. So my story is truly grounded in listening to patients and acting upon what that patient may be experiencing. But our journey to conception was one that was a peaceful journey. We had a discussion about becoming parents and tried that first month, and it happened. Yeah, it was a happy, healthy pregnancy in the beginning. I would say it wasn't until probably around the latter part of the second trimester and the start of the third trimester is when I, as a birthing person, started to not feel well. I noticed like the excessive like weight gain, but to my healthcare providers, they looked at it as like pregnancy weight gain. But me knowing my body, right, and knowing the foods that I was consuming, I'm like, I can't. It's not based on food that I'm intaking. Like, so I'll give an example. I had an 11-pound weight gain in 1 week. So for me being a healthcare provider, I'm like, there has to be water weight. Like that's fluid being placed on my body, which is not normal for that to happen in pregnancy. Something has to be wrong. But I was told by my provider different techniques on like how to shift the fluid that were in my legs. But I don't think people took me serious, right? I think they looked at it as they gave me a consult with a nutritionist, but I declined it because I knew it wasn't based on nutrition. Um, but yeah, once I got into the latter second half of my pregnancy, that's when things to me physically started to turn. And when I saw my providers or call for support, everything was just shifted to like homeopathic things, I would say, that needed to be done on my end versus like come in, let's be evaluated, let's see what's actually happening. And I always say that's why it was nothing but grace, that the day that I was diagnosed with severe pre-eclampsia, I actually had a routine visit. It wasn't something that I went on my own. And I'll never forget, I was in the gym with my husband, and not that I was exercising excessively. I just was walking on a treadmill, and I just remember telling my husband, I'm like, I really don't feel well today at all. I don't feel well, and I'm like, I'm just going to say that as soon as I go in the office, like I don't feel well. And once I went in and told the provider I didn't feel well, of course, after like the intake, she was like, oh yeah, you don't. This is your blood pressure, your protein in your urine. I'm sending you straight over to OB triage to deliver. And I was like, oh wow, finally. And not that I wanted to deliver, but like it was finally somebody understood that I really didn't feel well, right? And I'm like, now in their eyes, they had like laboratory proof, like, okay, now it doesn't look well for her based on these labs or these specific tests. So less than her to go deliver. But I'll be honest with you, I don't know that I would have went in on my own that day because I didn't feel well. I think my experience with healthcare in general, I probably would have just waited because I'm just like, oh, I'm there. You want to just tell me do this or do that, and we'll see you in a couple weeks. I don't think anybody will really listen to what I would have to say. So that's why I said it was nothing but grace and mercy that day I actually had a routine visit because I know the way, even though I didn't feel well, I know I wouldn't have just called again and say, this is what I'm experiencing. Can you bring me in? But that speaks a lot to how when people experience healthcare, how that could have an impact on their desire to want to call and follow up to see what's happening, because it becomes this process where you feel like you have to prove what you're experiencing, right? So I'm like, and that's hard, especially on the end where you're just on the telephone saying I feel this certain type of way, and then you have a healthcare provider saying, well, do this and do that, and then maybe it will get better, right? But for me, I always say I was a patient that had the universe working in my favor as well as the favor of my child, because I actually had a routine visit scheduled that day, right? That warranted me to see a provider. And then I said I didn't feel well. And then the labs, the screenings that were done supported me not feeling well, right? So it's just routine. They do the urinalysis, just the dipstick to see if there's protein in your urine. And then, of course, your blood pressure. Then they look at your face to see if there's like the orbital edema, which clearly I had for a while, right? But I mean, I just remember even at work, my associate dean told me, Shawana, stay home, because she was concerned about like the fluid. Like it's like, in healthcare, you're around other healthcare providers, right? And they can see you and they're like, yeah, this is different. This doesn't look like how a person should look when they're carrying a pregnancy, right? So I feel like it was even other people around me who can see that we're in healthcare, like maybe this is, everything may not be going as right. It's probably best for her not to be in a working environment. Let her work from home so that if something that she needs care immediately, at least she's home and can get that access quicker versus being at work and having to commute and all the challenges that comes with that. But yeah, so it was just routine that they do for all patients. You always have your vital signs done, and all pregnant people have the urine dipstick to see what's happening with the urine, if there's a UTI or protein in the urine. So it was routine, it was standard. So I would say in healthcare in general, when we think about preeclampsia isn't something that you necessarily can screen for, right? Those are things that are based on patients' reported symptoms, right? So you may have, which is when it gets really severe, changes in your vision, right? The excessive fluid, elevated blood pressure, protein in the urine. So there's not like a specific test per se for preeclampsia, right? It's a diagnosis based on multiple factors. And then we know the only cure for it, right, is delivery, right? So I think it's a balance. But for me, what I would say is where healthcare really failed me is I was already a patient that was at moderate risk for preeclampsia. My mother had a history of it. So I was a baby of a mother who had preeclampsia, right? So for me, I look at it as I should have been a candidate for preventative interventions, which includes like aspirin, right? But that wasn't offered to me, right? Knowing that I'm at moderate risk for development of preeclampsia. So I think for me, I look at it from the prevention perspective, right? And then the other thing I would say about my experience is the point of not being listened to, right? Not being listened to, not being validated, and having things acted upon. I think it's really critical, right? And I'm like, being a Black woman, we know the data in America, across the country, when it comes to maternal mortality rates, when it comes to health disparities and inequities, right? So being a Black woman, being an educated Black woman, I'm still placed at a higher risk for an adverse pregnancy outcome, right? So you already have those factors that are at play. And I would say a lot of it has to do with systemic racism, right? And a branch from that is biases, implicit biases, right? And this is a conversation that I talk about nationally, right? But it's something that people frown upon and say, oh, no, I'm not biased. I'm biased. We all are biased. It's something that naturally we learn it, right? But I always say the good thing is that we learn it, we can unlearn it. But the most critical thing is accepting that we have it and having awareness that we have it, and a willingness to actually change that. So I think with all of those factors at play, I just think healthcare has to change. It has to transform. So patients that look like me, that comes from communities like me, have access, not only access to the best care, because you can have access to the best care and still not get the best care. So have access to the best care and still receive the best care, right? So the plan was always for a C-section because he was proposed to be over 11 pounds, which he probably would have been had I went to term. He was 9 pounds 2 ounces at delivery, and that was at 38 weeks. So he would have probably made that 11-pound threshold and needed the C-section. So C-section was was already planned for. So I say the surgery went well. I actually had a black physician deliver our child, which was great. So the surgery was fine. It was really the postpartum period that I would say was the most sketchy in terms of care and being heard and validated and seen. I remember after delivery, um, they take you up to your unit, and as soon as I got to the unit, I was just flushed, whole bunch of sweat, just broke out of sweat. My husband looked terrified, and then all these alarms started going off, and going off, going off, going off, going off, and nobody came in for a while. And then all of a sudden, this nurse just runs in, and it's like nobody came, and she flipped me into the position to help bring my blood pressure up. So I'm assuming my blood pressure was plummeting. But nobody came for a while, and the nurse was just shocked that nobody came. I'm assuming I wasn't her patient. Yeah, I wasn't her patient. She's like, nobody came, nobody came. My husband's like, yeah, nobody came. And she rushed in, and then she flipped me into a position that allowed for my blood pressure to go back up. So that wasn't a great experience because whoever was supposed to be monitoring me wasn't monitoring me, and another nurse that wasn't on my I wasn't under her watch came. Well, thankfully she did come. Um, and then I just remember I didn't I didn't even hold my child probably until maybe like the fourth or fifth day in the hospital. Actually, really get to hold him. I didn't change a diaper. I didn't get taught like the basic things they usually, as nurses teach you how to care for your baby after delivery. He wasn't in the NICU at all. He was a big boy. He was 9 pounds 2 ounces. He didn't have anything. Um, he didn't have any complications um, from that. I was with him. I just don't remember holding him. Like people ask me, "Did you get hospital pictures with the baby?" And I'm like, "No, I don't have any hospital pictures holding the baby." My husband held him after. Yeah, my husband held the baby after. He wasn't in the NICU. He was in the room with us. I was on MAG for a while, magnesium sulfate, because of the preeclampsia. They put you on the magnesium sulfate to prevent seizures postpartum. Yeah, so I had that postpartum. But I didn't hold him. I didn't hold him. I didn't change his diaper. I'm like, my husband did everything. Yeah. Yeah, oh, I wasn't well. I'm like, I was very tearful. I didn't feel well at all. Yeah. So it was all almost like you go from you hear and everything just starts to go down, 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 down. That's what it was. Um, and then I was so happy to leave the hospital. It was a joy to be discharged and get out of the hospital. Yeah. We stayed up staying for 5 days. I remember them asking, did we want an additional day? And we said, no, we wouldn't go beyond the 5 days. But we stayed for 5 days. Yeah, I was extremely sick. Yeah. Um, it's the thing, symptoms, I wouldn't say. I just think you don't feel well, right? So I'm just like, yeah, I can't say what's like the exact symptoms. I'm like, you just don't have an ability to like move, to do anything. I remember the day was able to get out of the hospital bed. And I remember my parents were there. I mean, I could barely walk, but that's a normal side effect of mag sulfate, right? So I'm like, I don't blame that on that, but I just overall did not feel well. It wasn't, I felt horrible. And I just remember my provider, the one who delivered my son, she just said, you have so much fluid. Like I had 100-pound weight gain, which is not normal. That's the thing. I'm like, I know me. And it's like people, my providers to me looked at it as what I was eating. And I'm like, I knew. Like I was a former athlete. I ran track in high school. Right. I had a scholarship to run track on a collegiate level, but took a academic scholarship instead. which is wonderful. Because I'm like, track is a hard field because all you do is run. But I was athletic. I always moved, right? So even when I was pregnant, I always walked the treadmill at the gym, or I walked. So I'm like, it's not the food that's I'm taking in. And I remember she just said, you have so much fluid. And I mean, 100 weight gain during pregnancy, that's not normal. I'm like, that's not normal. And I knew myself, I'm like, that I'm not consuming that much food that will warrant that much calories to contribute to that weight gain. But yeah, 100 pounds, I'll never forget. When I weighed in, I had 100 pounds on me. And it was fluid. I knew. I'm like, it's fluid. Yeah, so that just you think about the care and how the providers couldn't see the trend. And I say no, but I'm like, as a provider, it doesn't matter who saw you before. You always look back. You look back for trends. You look back to see if there's something off. And I'm like, there was 100-pound weight gain, and I know it wasn't based on diet. There was something physiologically wrong. And I never forget my provider says you have so much fluid. So yeah, but I always say for me, I say I'm blessed because I live to tell my story, right? I didn't die alone with my child. My child made it, right? So I always say I'm a blessed person that had this experience because not a lot of people either they don't live or their children don't live to tell the story. Yeah, and I think healthcare in America is broken. It's a broken system that really needs attention, and it needs to be loved, and it needs to be reshaped in order for people to have better outcomes and better experiences. I just know from my perspective, when I gave birth to my son, the care that I received post birth and during the time of the latter part of my pregnancy before birth are things that I'll carry with me for some time, right? And it's my goal that other birthing people don't have those experiences, right? So for me, even though I've healed physically, right, I still have that psychological and emotional um, triggers that I think about and have not completely healed. It's almost like even when I talk about it, it's like a scar that you just open up and then you shut. You open up and then you shut. I experienced when it came to like breastfeeding. I'll never forget the nurse that was caring for me or supporting me with lactating. She gave my baby formula, right? Without offering me the hospital grade breast pump first, right? And then it wasn't until it's like, oh, you didn't get a hospital breast pump to see if it'll help the milk come in faster. Let's go. Let's switch. Let's give you that. And then, of course, like the milk came in, right? And is formula horrible? No. So I won't be a person that says no. You should never feed a child formula, right? But if a person's wishes is to have the child on human milk, right? Every effort should be given and opportunity should be given to that birthing person to be able to initiate human milk for their child prior to formula. But I just think it just showed the biases that are at play, right? And how advocacy is so important on all levels. But at the time, I did not think about the maternal health crisis in the United States and what was happening specifically to Black and Brown people. So I always tell patients, you are the most valuable person on your healthcare team. And you have to ensure that your healthcare team is a team that does see the value of you and your voice and listens to what you're experiencing. And not only, I always say it's great to listen, but you have to listen with the ability to validate what that person is experiencing and acting upon it, right? Because you can listen to a patient and do nothing about it. So I'm like, there's steps that go along with it. So I would say listen, validate, and act. And I always tell patients, you're the number one player on your healthcare team. And if you're in a healthcare team that you don't feel supported, it's your job then to try to find another team that allows you to feel supported. So I think it's bi-directional, right? It's not just healthcare. I think it's patients and healthcare partnering together to ensure best healthcare outcomes. But with that being said, I always say patients still should feel safe, right? And they shouldn't feel as though all the ownership falls on them, right? But as a patient, unfortunately, because of the society we live in, and knowing the healthcare outcomes, being in a developed country, in the United States ranks horribly compared to other developed countries, and our healthcare costs way more. But knowing the structure of our healthcare system, it does require patients to advocate for themselves and to seek a healthcare provider who really makes them feel safe, who provides adequate and proper care for them, and just understanding that as a patient, you're the number one person on your healthcare team, and you have the power and you have the ability to navigate your healthcare system. And if you don't feel that empowered to do so, surround yourself around friends or family members who can accompany you to your visits to help support you in that way. Because I know sometimes in pregnancy, you can be very overwhelmed with all the information being thrown at you. But if you can bring a friend or a loved one that you are close to that you know can help advocate for you, I recommend that as well. But my experience really helped me hone in and have a deeper and greater understanding to that and to those experiences of individuals that look like me and come from communities like me. And boy, I've done a lot of advocacy around it now and written articles around it now and engaged with legislators and moving the needle forward with addressing the maternal health crisis in our country.